The following program, produced and funded by MyFaceMyBody, was also partly funded by Zoom, TSL, iGuide, BodyTite and Glow Minerals.
Welcome to My Face, My Body, the show that aims to answer all your health and beauty questions. In this series, we'll be travelling the length and breadth of the UK to give you the latest cosmetic and beauty treatments on offer, answering all the questions your body needs to hear. It takes a lot to get a body like this, but sometimes we have to go to the extreme. By the end of this show, you'll find out how to get that rock-solid physique. Woohoo! Coming up on this show, we'll be looking at our top news pieces this month. Are men taking a greater interest in their appearance? We look into some of the beauty treatments common amongst men. We head to Glasgow and Liverpool to find out how they define beauty and some of the popular beauty treatments they are having. We all enjoy summer, but not if we suffer from migraines. We speak to a couple of experts who help us find ways to relieve some of this discomfort. And we look at some of the other popular treatments people are having before their big summer break. Have I got some great news pieces for you this month? Here are fair to remember. Wayne Rooney's teammate Rio Ferdinand has joked that Rooney's recent hair transplant was an attempt to receive sponsorship from Head & Shoulders shampoo, but most people agree that it was a great move on his part. His wife Colleen tweeted that she had nothing to do with his decision. Well, I guess we'll never know. Our survey discovered that 76% of men would have a hair transplant if they were prematurely bald and their partner asked them to. Being young and bald can be a bit of an issue because we also found out that 38% of men have been dumped by their partner because of their hairstyle or lack of hair. That's definitely a case of hair today, gone tomorrow. The good news is that our poll found that bald movie stars Jason Statham, Samuel L. Jackson and Sean Connery were all thought to be sexier bald than when they had hair. Ever heard of a magic mushroom? You don't usually associate mushrooms with beauty, but it seems that celebrities have caught on to one variety of the funny-looking fungus in a bid to keep looking young. Celebrities such as Kirsten Dunst, Halle Berry, Madonna and Meg Ryan have all been spotted sipping on kombucha, an ancient remedy from China that's said to contain a whole host of health-boosting properties. Fermented extract of mushroom may not seem the obvious thing to put on your face, but according to experts, it has a power to multiply collagen cells, which plump up the skin and improve its appearance. At Harvey Nichols, which stocks a range of products containing the magic mushroom, they recommend using kombucha tea as a facial steam treatment, then drinking it, so you feel both the internal and external effects. So there's your news. More next time. Are men taking a greater interest in their appearance? Are we influenced by what we read in magazines? Do we follow celebrity fashions? Do women want us to look like their favourite celebrity hunk? We find out more from one of our leading cosmetic experts in Preston, Dr. Stephen Hennessy. What is the trend you see towards males coming into your clinic to have?
Definitely there's more men coming in now. I would say percentage-wise, we're still looking at 80% women, 20% guys.
Yep.
But that 20% has sort of come from nothing to 20% over, really the past few years. It's definitely increasing more and more. They've let the ladies test it, and then their guys are coming in for it.
Do you think males keep it secret, or do you think they tell their other mates? Or...
Yeah. I mean, in fairness, the women have kept it secret for many years. But now it's becoming more and more common that people are admitting they've had Botox. It's not quite such a taboo subject, but I think for the guys, they're still in that early stages where it's not that cool, so it is a bit more taboo. And the Botox, the good thing about it is they can get away with it. It's very subtle, there's no great signs of it, there's no downtime. So if they don't want to tell anybody, they don't have to.
Still can't really imagine a group of guys at the pub all having a pint and then saying, how was your Botox injections the other day? But they might, I don't know.
In fairness, no, I get where you're coming from. I don't think it has gone that far yet. I think that's still, again, a few years down the line. We had a guy the other day who was getting married. His fiance brought him in, said, oh, you're going to have it in this. And he was fairly open about it. And he said when he goes on the stag do, he's going to tell everybody. So, it's getting there. And I think they'll put it across as a bit of a laugh. I think it's increasing, and it'll take a while before the guys are actually, openly admitting it.
So just to obviously educate the audience with regards to Botox. So Botox, obviously, it paralyses the muscle. It's good for a preventative. People not wanting to see the signs of aging so quickly. Is that right?
Yeah. It's preventative and corrective, because the muscles on the upper half of the face are the ones that cause the lines. So your frown lines, your crow's feet across the forehead. It's the muscle that does the damage. So the Botox will relax that muscle, stop it damaging the skin, therefore kind of erase the lines you've already got and prevent lines coming as well.
But it's still quite confusing, I think, for a male when they walk into maybe a male grooming store, and it's quite overwhelming with the amount of products, and it's like, oh God, where do I start?
But I think that's life. I think it's confusing for men and women, isn't it? In fact, I'd rather be a guy than a woman, because I think when you go into the selection, it is huge.
Today we're talking about abdominal weight gain, otherwise known as the beer belly. Beer bellies are commonly associated with one too many pints down the pub, and it's true that alcohol can play a big part in weight gain. Did you know that a pint of beer contains up to 250 calories? Or that a glass of wine contains the equivalent calories as a slice of cake? This means that your alcohol consumption can quickly add to that pot belly. Many of us are unaware of how much it's safe to drink. Women shouldn't regularly exceed 2 to 3 units of alcohol per day. That's the equivalent to 1 small glass of wine. Men shouldn't exceed 3 to 4 units of alcohol per day. That's equivalent to 1.5 pints of medium strength beer. If you regularly exceed this limit, you'll not only pile on the pounds, you'll also be increasing your risk of a host of diseases, including cancer. I went to London's business district to speak to some city workers about their drinking habits.
Hi guys, you're enjoying your drink here at work?
Lovely.
And you a regular drinker?
Indeed.
And do you ever worry about the effects of drinking on your health?
No, not at all.
No.
No. As you get older, everything drops.
Right.
You've got that to come, my darling.
We've got the two Johns here. The John that works out and the John that doesn't work out.
I don't work out.
You don't work out.
Does it not work out?
So the key here probably is moderation, a bit of
Exactly
drinking,
right. I'm only
balanced out
social
with some
drinker.
exercise.
I don't drink every day. I'm just a social drinker. You know, yeah. When people buy me a drink.
If you think you're drinking too much, here are some practical ways to cut down. Make your drinks go further. Opt for bottles of beer or half pints instead of pints, and drink them slower. Choose small glasses of wine and add soda water to make a spritzer. Eating a healthy meal before you go out can help slow the absorption of alcohol into your bloodstream. Keep hydrated. Hangovers are largely due to dehydration, so keep hydrated by alternating alcoholic drinks with soft drinks like sparkling water with fresh lime. Be the designated driver. By taking your car on a night out, you'll have a good excuse to stay teetotal. Many of us have an after-work drink to relax, but in reality, alcohol can actually make you feel even more anxious. Try some alternative stress busters like hitting the gym with friends or running a bath at home and putting on some relaxing music. For more information on practical ways to cut down your alcohol intake, go to www.MyFaceMyBody.com.
Raoul, in your practice, what do you see the ratio being between females and males actually coming to see you to have treatment?
You know, that's an interesting question. Appearance is so important in careers that we now almost have a 50-50 ratio of male to female.
What type of treatments do males come in and see you about?
Most of the male patients, they want to improve everything. They want to look good, so it's often the whole smile design. To other countries in the world, Britain had a reputation for not having good-looking teeth. But with media and with programs like Extreme Makeover and 10 Years Younger, that's changing. So people want to look better, and the male population wants to look better as well now, not just female.
And I agree with the shows that are on television. It's really opened, I think, our eyes up to actually seeking to get things like cosmetic dentistry done.
And I think another reason why a lot of males come in, believe it or not, is when there is a separation in their life from their other halves. And that's both sides of the party.
Okay.
So they're now trying to now regain their youth and regain their smile and regain their confidence to try and attract the other half again.
Celebrity hotspot San Carlo's Italian restaurant in Liverpool. And we're going to be asking some of the locals about what they do to look good. What would you say a typical Scouser girl is like?
Makeup, dot, orange.
False eyelashes, you name it.
Yeah.
Liverpool girls are all about appearance.
Fake tan.
Yep.
Goes with fake tan. Put my eyelashes on, put my face on, and try and get my hair as big as I could.
I always have to have like loads of makeup on because it makes you feel more confident when you go out.
So you've got some self-tan on tonight?
I do indeed.
Okay, brilliant. What would you say the Scouser guys do? Do they look after themselves? Or?
The ones that if you looked out for yourself, like in Liverpool, you'd go on the sunbeds and everything.
It's one extreme to the other. You're either like hairy and you don't care, or you're a pretty boy and hair done, facial,
gym every day.
Do you wear a bit of fake tan yourself?
No.
Are you sure?
Positive.
Okay.
I've probably not got the best diet, but I do like sport and I like swimming and stuff like that.
Now I heard in Liverpool there was something in the newspaper about these tablets that people ingest, tanning tablets.
You can get tanning injections as well.
What about cosmetic surgery later on in the future? Would you ever consider that?
Never say never. If technology and medicine can improve something that you don't feel confident about, fix it.
Here at the Lip Doctor, one of our most popular treatments is lip augmentation. This involves the injection of a filler made out of hyaluronic acid to define the shape and increase volume in the lips. This type of treatment appeals to a wide variety of ladies, from the younger ones who want a sexy pout to the lips or more volume, to the older ladies who've lost volume through age and developed lines, in particular the smokers. We're also doing more men.
Today I'm having my lips done, I'm having top and bottom, mainly just to give my lips more volume.
The procedure involves, first of all, numbing both lips with exactly the same anaesthetic you would get at the dentist. Once I'm satisfied the lips are numb, we're going to run a fine bead of filler along the lip margins where you girls will draw your lip line or call the vermilion border, and that will define the shape and give it a touch of volume. And then I'll be doing some different techniques to create volume within both upper and lower lip.
Whether we're busy at work or lying on the beach during our summer holidays, there's still a large percentage of us that suffer from migraines. Now I'm here with Dr. Bijou Krishna from Lubiju and Kirsten from Edinburgh Physiotherapy Centre, who have got a combination treatment which really helps relieve some of the symptoms with migraines. Now Bijou, can you tell us some of the treatments that you offer in your clinic in helping people relieve some of the tension from grinding that obviously is one of the symptoms to migraines?
Certainly, Stephen, yes. It's a very common problem. I think it affects over 10 million people in the UK. Primarily we do it overnight, although some people are unconsciously doing it during the day as well. But for the vast majority of people who do it at night time, studies have shown that they can exert up to 20 times more pressure in their sleep when they're clenching or grinding than they can do consciously.
Wow, okay.
That places a tremendous pressure on our teeth, obviously, but it also affects the muscles around the face, the head and neck.
So we've got an example of a splint.
Yes, we have one just here. It's a very small splint. I don't know if you can see it.
Okay.
It's only about a couple of centimetres square.
Okay.
Unlike the old splints that tended to fit over the complete arch, this just really fit over the front teeth.
Okay.
This is much more comfortable, and what it does is it takes the big pressures away from the back of the mouth. So these big muscles are not being engaged when people grind or they clench.
Yeah.
80 to 90% of the pressure is taken away from that.
Okay. So Kirsten, can you tell us, how does physiotherapy help relieve some of the symptoms associated with migraines?
What we do is we actually look at the muscles that have gone into spasm from clenching, from grinding your teeth, and we actually start by working on those. And these muscles here are one of the primary set of muscles that we start to work on and loosen. If you actually feel muscles, if you do grind your teeth, you'll actually feel that these muscles are usually quite tight, quite often one side more than another, so that actually puts a kind of lopsided pressure on the jaw joint. You find that with people that have migraines, they can have postural problems too, so they may be sitting forward like this, which puts more strain here, and that causes problems with some of the upper joints in the spine. So it's quite a varied. Let's look at what's actually not working properly.
Thanks very much, guys, for coming in today to give us some great consumer insight into migraine treatment. If you have any comments or feedback regarding our discussions on migraine treatment, we'd love to hear them on MyFaceMyBody.com. I haven't been to an orthodontist since I was a kid, but I'm really interested to find out how orthodontics has changed and some of the options that St. Michael's offers to their patients. Let's go check it out. Well, we're here in Wakefield in a beautiful orthodontic practice. I mean, it looks absolutely amazing as soon as you walk through the door. I mean, how long have you been established for now?
Well, we've been established for 15 years, but the practice and the demand for orthodontics has grown so rapidly. This is our third extension, which we completed last January.
Yeah. It's like coming in, the first feel of the clinic's like coming into a beautiful hotel reception area, and then obviously the clinic rooms are fantastic. So you're really, I suppose, patient comfort is one of the key things.
I wanted patients to come in and feel totally relaxed and comfortable, and I designed it such that, you know, it would feel more like a homely feel to it rather than a very clinical feel.
When I was younger, I had the fixed braces, you know, big metal braces. I mean, is that what people still have today, or I mean, what's available?
Well, the fixed braces, a lot of our teenage children love these, for example.
Is it these ones here?
Yeah, these with the colours on it, and.
Oh, I wasn't allowed colours.
Oh yeah, very. So they get great fun and excitement when they come in and choosing the colours. As the adult market is growing and more people, adults are now having orthodontic treatment, we offer now a much bigger scope of cosmetic braces, including the more cosmetic fixed braces. Okay. And a very popular treatment choice for adults is Invisalign, and Invisalign is virtually invisible. It's a series of clear plastic aligning braces which gently move the teeth into position. And when these are in place, people don't even really notice you're wearing a brace. So this is very popular with a lot of our adult patients.
What are the typical male patients you see coming into your clinic?
There certainly has been a big increase in the number of males coming now for treatment. And yes, generally they do go for more cosmetic options, and Invisalign is very popular with them. Age range, you know, generally about 30 to 50, but we've even treated a gentleman who was in his late 60s. And he said it was the best thing he'd ever done. So
you're seeing more adults coming in and asking for their teeth straightened and...
Absolutely. I mean, the market has just grown in a phenomenal rate over the last few years, and we get a lot of parents who have seen the difference that we've made to their children. They've seen not only just them having lovely straight teeth, but the difference in their self-confidence and their self-esteem. And then they say, well, I want this done. So we do get a lot of parents coming back for treatment when they've seen what results that we can achieve.
Correct. What motivated you to get braces in the first place?
Well, it was a couple of years ago at school now, and it was almost a fashion trend to have a brace. Everyone was having straight teeth. It was almost like must-do thing to have these straight teeth.
Did you have the coloured ones, or did you have just the straight?
Yeah, I mix and match the colours all the time to go with, like, it was the Olympics, I remember. During I had my brace, so I had red, white and blue for...
Oh, fantastic. Look at that, patriotic, eh? Oh, fantastic. Yeah. Would you recommend sort of having orthodontic treatment at an early stage?
Absolutely, yeah, absolutely. It puts you in steady, makes you confident for the rest of your life. Interviews, applying for things, it just makes you smile.
We're here at Philip Friel's Advanced Dentistry Clinic in the heart of Glasgow. Dr. Philip Friel has just been awarded and is the current holder of Scotland's Best Young Dentist Award. Let's go and meet him. How would you describe a typical Glaswegian patient?
I think typically the West of Scotland gets a bit of a bad reputation historically for dental health in general, and some of these trends unfortunately continue to this day, but we are seeing a real shift in the attitude towards health, if you like, of Glaswegians and I suppose Scots in general. So we're now seeing patients that are perhaps more demanding, they are more informed than perhaps they were in the past, and they're aware of exactly what's available to them.
So you would say that people living in Glasgow are sort of more conscious now about sort of the way they represent themselves, the way they look, and are willing to spend and invest the money in
Absolutely. As I said before, Glasgow is now a very, very cosmopolitan city, you know, and that ranges not only from the types of housing that are available, the shops, the boutiques that are available, the restaurants, the hotels, you know, it's totally changed in the last 30 or so years. And I think other industries, and dentistry is no different, move along with that.
Do you think with regards to 10 years ago that more people are seeking cosmetic treatments in Glasgow?
For sure. I think there's no doubt about that. And it's a generational thing. It may be our typical younger type patient will be aware of the benefits that tooth whitening procedures, for instance, can make to an otherwise healthy dentition. And that's really a nice situation to be in, when people have had the education to maintain the healthy teeth that they were born with and just seek very non-invasive, very, very limited cosmetic procedures. Our clinic is, it looks super, you know, it's designed, it was my wife who designed the interiors of it, and it's made to relax people, to calm them while they're at the dentist. And I think more and more, not just in my clinic, but in other clinics, that it's more the lifestyle choice that people want to make. So as well as the advanced treatment that we offer, it's the facility, it's the environment, it's the team that will actually make people select our clinic.
Well, it's all about beauty this evening. We're here at the Miss Scotland Beauty Pageant 2011. Well, as you can see, we're down to the last 5 contestants, and it's nervous time because they're about to announce the winner. There you have it, a beautiful Glaswegian. She knows everything about beauty, and we're going to go get an interview from her and obviously find out what it takes to look that good.
I was thrilled. There was 10 very nervous girls tonight, but they all sailed through their dance routines and they had quite a lot to achieve in such a small space of time. You know, 10 years ago it was very, very pageanty, and everybody was very, very blonde and very, very curly and very, very thin. And now, you know, we've never wanted a pageant girl, we've always wanted an ambassador for Scotland. So over the 10 years, I mean, we've had every shape and every size, and Jennifer is a bit curvier than most, which is wonderful.
So, how does it all feel?
Don't think it has words, to be honest. I'm absolutely gobsmacked. I can't believe it. I'm usually quite an articulate person, I like to think.
What efforts did you have to go to make yourself look this good this evening?
eating well, always like I enjoy sport, so that sort of comes reasonably easy to me. I like going out for running and things like that. Everyone's competition is gorgeous, and they showed that you don't have to do too much, you can just come out and be effortless.
Here at the Sculptor Clinic in Glasgow, we're here to look at some of the latest treatments they've got to offer, such as stem cell therapy. Let's go and have a look. What would you say with regards to the type of patients that come and see you in the clinic, and is it now popular for males to have some of these types of treatments?
It's very popular. I would say about nearly 20% of our patients are male. And that's probably in keeping with the sort of national UK trend, which shows a 300% increase amongst males in the cosmetic and aesthetic industry just now.
And what sort of treatments do you see them coming?
Males, very popular, pain-free laser hair removal. Men cannot do pain, and it's great. So since we've had this, it's been great. Hair implants, hair implantation is a big thing. And again, as I said, the vaser keyhole liposuction, it's just giving definition to the body, which is a big thing now amongst males. Yeah.
Do they have laser on the face?
There is a trend just now amongst the younger ones, believe it or not. It's known as the designer stubble, where they're coming in and they're having laser to this area here.
Okay.
The cheek, not here, and actually under here. So when they have hair growth, it's actually a very defined hair. It seems to become very fashionable these days, but it's pain-free, and they love it.
Yeah, I think when I was at school, we had competitions to see who could get facial growth the quickest, and now I'm going, I don't want facial growth. It's annoying having to shave every day, so that's interesting. And just lastly, with regards to the stem cell treatment that you do you see many people coming to ask you about this?
Yes,
is it a new treatment?
It is in the aesthetic industry. In the cosmetic arena, it's new. It has been used extensively to treat burns, especially in children, to prevent scar tissue and to promote healthy skin growth. The treatments that we have here, we're having patients from as far afield as California. We've had patients from Kazakhstan, we've had patients from Libya, all come in here for stem cell therapy.
Wow.
Yeah.
So the results are pretty dramatic?
The results are absolutely amazing.
So how do we get that rock solid figure without going to the gym? Well, I'm with Cole from Climb London, and he's going to tell us a little bit about the benefits of rock climbing.
Well, rock climbing is a tremendous sport if you're looking for total body fitness, because you've got obviously a lot of upper body. You've also got lower body as well. We're trying to get the legs into the picture, help us move ourselves up the wall without using our arms too much. Saves us some strength up here, but it also develops our core and our legs. And it's an absolutely fantastic activity if you just want one thing to do and get total body fitness.
So it's a full body workout?
Absolutely, yeah. And you'll feel it.
Oh, yeah, I'm sure. I've done it a few times before, and I'm pretty achy, especially the next day as well.
Yeah, definitely. That passes in time, as with anything. Once you start developing the muscles and they start getting into some endurance and fatigue relief mode, then you can move right into climbing every day.
Okay, is it as popular for ladies as it is for men, or?
Definitely, and the best thing about being a woman and starting climbing is you're guaranteed to start off better than a man. Men always try to ape themselves up the wall, always try to hold themselves up, but really it takes a lot of lower body coordination and technique and grace, and because women don't naturally have this upper body strength, they get their legs into the picture a lot faster, and every time we run a taster, mixed women and men, the women are always much better.
Because I think a lot of the time, I've seen it before, I've seen guys really trying to get to the top quite quickly, using their arms, pulling themselves up, but it is all about the legs as well, isn't it?
That's not the way forward. You've got to get the legs into the picture.
So, typical age of person that would come and rock climb, is it for more younger people, or?
No, we take all ages. We start at 4 years old, so children can get into it quite young, get the whole family into it in some of our mixed family sessions. And some of our instructors are well into their 60s, so it's certainly a skill and an activity for all ages. Definitely.
Great. I'd have to do a bit of encouraging with my mother to get along to do some rock climbing, but I'm sure we could get her started.
If she loves you, she'll do it.
Yeah, exactly. I'm off to have a little bit more fun before I have to go back to my day job. If you've got any questions or want to find out any information, go to MyFaceMyBody.com, and don't forget to follow us on Twitter and Facebook. We'll see you next time.
This programme, produced and funded by MyFaceMyBody, was also partly funded by Zoom, TSL, iGuide, Bodytight and Glow Minerals.